Medical disclaimer. Please note that the information shared on this podcast is for educational and informational purposes only and should not be considered medical advice. Always consult with your healthcare provider before making any changes to your health regimen, including starting new therapies, supplements, or treatments. While we discuss cutting-edge research and advancements in cellular medicine, individual health needs vary and professional guidance is essential. By listening to this podcast, you acknowledge that neither Dr. Seeds nor the podcast team is providing personalized medical recommendations.
On today's episode of Redox Revolution, I published a paper. Welcome back to the Redox Revolution. Matthew, Maddie, always good to see you.
It's good to see you too. I gotta say, so far this winter has nothing to do with the topic we're going to talk about today, but not a lot of snow for skiing.
Hey,
it's still good. Skiing is still skiing, but not a lot of snow.
Yeah, you know what though? Here's how I look at that. Okay.
Yeah.
Blessed to be in the mountains. Blessed to be in a world that if you appreciate that setting, there's nothing like it. There's nothing like that feeling you get. And I can't explain it, but on top of that, if you get a chance to be on some skis and say it's not ideal, but you still got the ability to make a run, you work on basics. You work on you can never do enough to get better. There's always something you can work on that could have an influence then when you do get snow and you get different conditions and you get that crud or you get that powder or you get it's those little things that you continue to work on. You know, getting up on edge, feeling that push, getting that ski bent, it's like...
I feel like skiing is where you find your flow state.
Yeah, it's like you can I can figure out a way to make it the best day ever every day.
So, Maddie, most people are into either like powder days or groomers. Do you want to guess why crud is my favorite type of skiing? Crud is like, do you know what crud is?
I picture crud as just the snow on the road after a plow's gone by, so no.
I mean, kind of.
That's not bad.
It's like a day after powder when everyone's already gone through and it's been knocked around and it got maybe a little frozen overnight and needs to soften again the next day, but
it can
do you know why?
It can be cement, it can be a little softer.
Do you know why crud's my favorite?
Because
Why?
it's always different. It challenges you.
No.
Why? Because you just like to crush it?
No.
I was going to say, you like to ski fast. I feel like crud would slow you down.
Oh, it doesn't.
Yeah, but there's something I like even more than skiing fast.
Destroying crud?
No, it's nobody being around.
Oh.
Nobody wants to go ski in the crud.
Oh, that's true.
So you get the mountain to yourself.
Exactly.
Well,
Nice.
you get. I mean, there.
half of the fun of skiing is just being the man on the mountain and like being in nature. And
crud.
I enjoy that aspect of it. Yeah.
Well, the cool thing is though too, you see all the people that pop out in the crud, and you think you're pretty good, and then you get humbled, and you're like, whoa, just see that guy or that girl crush that crud.
It is fun too because you're not the best in it, and so it's where I almost fall the most, and so it is a little bit challenging.
A lot of yard sales in crud?
Oh yeah.
Oh, I've made my own yard sales. It's humbling.
You gotta always carefully be reviewing the snow as you're going through it, because at the top and at the bottom it can be different. And you know what? Speaking of reviewing snow...
Oh, wait, can I just say one more thing?
No, you can't, because that was the perfect segue.
Oh.
Speaking of reviewing snow,
Yes.
you had an article review published recently, published last month actually, called Therapeutic Peptides in Orthopaedics, Applications, Challenges, and Future Directions. If you have yet to read the paper, I would highly suggest it. Therapeutic Peptides in Orthopaedics, Applications, Challenges, and Future Directions. If you go to the ssrpinstitute.org. In our news bulletin, we have a link directly to the abstract. And if you don't mind, I'm just going to read the abstract real quick because it is fantastic. I try not to be a robot here on the show, but we've done a lot of table setting here, and I want to talk a little bit about what this paper is about. So, therapeutic peptides are emerging as promising adjuncts in the management of orthopedic injuries, grounded in their ability to modulate molecular signaling networks central to cellular medicine. By acting on key pathways such as PI3K-AKT, mTOR, MAPK, TGF-beta, and AMPK, peptides exert influence over tissue regeneration, inflammation resolution, and neuromuscular recovery. Wound-healing peptides such as BPC-157 and GHK-Cu promote angiogenesis, integrin-mediated extracellular matrix remodeling, and fibroblast activation. Whereas growth hormone secretagogues like ipamorelin, CJC-1295, tesamorelin, sermorelin, and AOD-9604 activate IGF-1 signaling and satellite cell repair. Recovery-enhancing agents such as epitalon, delta sleep-inducing peptide, and pineolon target circadian and mitochondrial regulators, and neuroactive peptides like Cellink, Cmax, and Dihexa enhance brain-derived neurotropic factor and HGF-c-Met pathways critical to neuroplasticity. Although preclinical studies are promising, there is a current lack of clinical trials. This review integrates current mechanistic insights with orthopedic relevance, emphasizing safety, efficacy, and future directions for responsible integration into musculoskeletal care. Dr. Rahman, Dr. Lee, congrats. Dan, congrats.
Thank you.
Very cool.
Doc, congrats.
Yeah, thanks. It's a step forward, and you know me, or you know us. Head down, let's go. I do want to say, hey, Stephen Lee, Dr. Lee out of New York, known Stephen for quite a while. Stephen guided Omar to me, and Stephen is a mentor of Omar's. Omar trained under Stephen, and look at this network. You know, you have a mentor, someone Omar, who respects the hell out of Stephen, who's an excellent hand surgeon out of New York, who we had a conversation. I don't know how many years ago. Stephen's been very interested in peptides, and he approached me quite a while ago, and I never knew it would lead to this. Incredible, right? How that all happens. So,
number one, congrats. Very cool.
Woo woo.
Published in the Journal of the American Academy of Orthopedic Surgeons. We're just going to start right off. Tell us about it.
Global Research and Reviews. You forgot that part.
Tell us about it.
Well, first of all, thank you. And thank you to Omar Rahman and Stephen Lee, who were co-authors, who essentially made this happen and came to me to help in, I think, putting together something that has been long overdue. And it's always been in the back of my mind. Let me say, I'm very excited about the publication, but I'm even more excited about where this publication is.
Yeah, why is it so timely?
Well, not timely, but I'll get to that in a second. That separates this a little bit.
Different where? Okay.
I'm excited about it being in this journal because
Orthopaedics.
Yeah,
okay.
it's entered. It's now a discussion that has entered academic medicine. It's here. It's a privilege to be here.
And clearly you know a little bit of something about orthopedics. You were a surgeon for like 3 decades. So
He gets
yeah,
very
why is
offended
it
when you say "were a surgeon." He will say, "I'm still a surgeon."
retired surgeon as of February 2023? I remember the day very well because that is the day he found a renewed focus for more initiatives within the SSRP, and it was wonderful, and I love it, and you deserved it. But
and cellular medicine, that is something.
so why is it
what I do.
important for orthopedic surgeons to now be weighing in on peptide therapy? Obviously, you were doing it before, but like you said, for where?
Well,
Keep going.
Well, I think when you said the timing is this is again, that splits it into 2 more answers here.
Never a simple answer.
You're overwhelming me here. Let me back up and say,
I'm overwhelming you.
let me back up. I'm still thinking about the crud and skiing and stuff. Let's say that this is a discussion that is already happening. This is being practiced right now. It's here. Physicians are practicing this. Patients are demanding this. Patients have the knowledge base of this, let's say they're trying to become educated in this era of peptides, and it's a phenomenal push right now, as we've seen in the last few years, and I think there's so many things I want to say correctly about this, but this is for us in medicine here today. We don't have the I think the ethical, structured, rigorous framework right now that I think is going to be demanded to look at this responsibly of what's happening with peptides right now. We need to demand that, and that's what this paper is really intended to do, is to open up that discussion and look at to provide physicians with looking at this from through mechanisms, safety, regulatory standpoints, and also in looking at evidence gaps that we have to be curious about, and we have to do this right. And so this paper just introduces that into this academic place where that's what we do. We demand rigor. We demand discipline. We demand this review that's appropriate so we can represent this correctly. And that's what we're about here in the SSRP. And it's now, I feel like, oh my gosh, I've waited for this for so long to have this discussion. Does that make sense? It
makes sense. I can tell the gravity with which you're trying to bring to this, because most of the time when you dive down rabbit holes, you're talking as fast as I am right now. And you're actually kind of slowing yourself down a little, which is weird to watch. You're trying to pick your words carefully because, I mean, you pinned it yourself. It seems like for a long time, academic medicine hasn't taken this seriously because of the lack of, human-based evidence. And so this kind of feels like not that first, but just another domino falling in that direction, which is very exciting.
Well, look at this. I mean, orthopedic surgeons, we sit on that edge of where surgical repair meets biological breakdown of tissue. Like we sit at that precipice of really understanding how those two areas meet. I mean, that's a unique place to be. I mean, this is how this all started. This is how peptides came to fruition a long time ago when I wrote that first book or before all of that, and how I got involved in it, because we're there. We're that connection of truly understanding the breakdown, mechanical breakdown of tissue, and the ability of biological repair. It's our responsibility now to take those, the understanding of these mechanisms, which we're all about mechanisms and molecular pathways, and providing this scientific framework to truly show the research that needs to be done. Again, this paper demands, I'm not out there saying peptides are cures. I'm out there saying we need evidence-based research. We need research that is going to once and for all follow what I believe we know in the mechanisms of these molecular pathways of cells and how things can change, cell recovery, repair, and so forth. We have to provide that evidence now to move forward, to keep people safe, to keep patients safe, to show, to curb this enthusiasm of all these bullshit social media experts that claim all of these crazy things that I think are a disservice to a truly beautiful process of mechanisms and pathways of providing cell renewal and repair, and giving us a new look, a new era in medicine, of cellular medicine, right? Because this brings me back to, hey, guys, this is all about cellular mechanisms and how signals are travel through cells and tissue to through tissue that then work. I know you. Why are you fucking doing that? I'm really trying to think about this, because this means this is actually. You have no idea how long I've waited to be involved and get a message out, and I hope this shows you. You know, he's pissing me off because my passion is here with this, and it's been here forever, and it's finally reached a point of where I get to have a discussion now with people and show people the real science and show people that this can be done correctly. So you've got cellular medicine that talks about signals and how they're sent through cells and how cells respond to injury and stress, and then on the molecular level, how that meets. And we know how these things happen, and now we get to finally set the parameters of the research that needs to be done responsibly to show, I think, this new era of cellular medicine and molecular mechanisms that are going to change the world.
There he is. So you've been leading this for quite a while now. So Maddie, I actually kind of want to ask you, as somebody who came from that more academic side of medicine, worked in the ICU, and then just kind of sifted and found her way into this whole arena. Without that huge backing of clinical evidence-based studies that most people are often looking for, they want that mountain to prove that this is actually valid. How did you find your way into accepting everything that Doc was doing at Redox?
Just because it was actually making a difference, a positive difference. You know, coming from an ICU, those patients, I mean, could keep a rock alive pretty well, but it was like we were just in the ICU, you know, you're in survival mode. They're obviously, you need to do those Band-Aid things to keep them alive. But even when I was going through grad school and like did you just get your phone out?
Turned it silent.
rude. But even like in the doctor's offices and everything, no one was really diving deeper into like, why are you having this issue? They're like, oh, you're having this symptom. Here's the medication. And it was like, okay, but why are they having that symptom? Why don't we look at that? And so then coming into this side, I just heard at the beginning, I don't want to say skeptical. I just didn't have a knowledge of what it actually was. But then just hearing patients talk
Sounded cool.
Yeah, sounded really cool. But then just hearing patients talk about like, oh, I got to get off this medication. I feel better than I've ever felt. I was like, I think he's onto something.
And these are situations where you're like, that doesn't make sense. They shouldn't have been able to come off that medication.
Yeah. Like they've been on it for years, never told they could get off of it, and they're off of it.
So as this evidence has started to build, if we can set a differentiation real quick, what is the difference between preclinical trials and clinical trials? It may sound rhetorical, but I do want to draw that line real quick.
Preclinical trials, I think you look at preclinical trials are what's possible. You're asking the questions of potentially you're doing studies, what we say are in vitro in cell culture or in animals, and we're looking at safety, toxicity, mechanisms, and we're trying to provide the questioning. Do we have a plausible way of possibly moving forward to solve?
You're building the reasonable hypothesis.
Yeah. And then and that's built around safety and so forth. And then the clinical trials are there to validate that it is number one, clinically safe, and number two, it follows the hypothesis that you've proposed, and that it is validated and real.
So basic is like, it's safe to say preclinical, it's not dealing with humans. Clinical is when it's actually reaching the humans.
Could preclinical also just be anecdotal review? Say, you said what brought you really into this was being able to see what it was actually doing to patients every day. And that's not technically a clinical trial.
But it's
You're
evidence.
Just seeing it, yeah.
Well, that's more clinical evidence-based. It's a little different approach, which I think is where medicine's heading, actually. When you have limited data or data on a disease or a metabolic problem or injury or so forth, you need to understand mechanisms and molecular pathways to appropriately make assumptions or to go forward with looking at a problem. And that's the beauty of cellular medicine.
The pathways.
If you understand molecular pathways and mechanisms, those are the keys, I've said it before, to the kingdom. You have a valid way of questioning. You have a way of moving forward with limited data, but then can work forward to propose those studies or those cell culture studies, those animal studies that will then potentially lead to then saying, okay, this is plausible. Then, okay, let's take the next step and say, does this work?
Well, the mechanisms allow you to provide your theory, but they're also a little bit of your guardrails too. And I feel like the mechanism and the pathway approach, I mean, that's what the entire SSRP has been built on, this ethos of cellular medicine. And it has been cool to see that message actually start to be received and start to be trusted, not in the absence of advanced clinical trials, but almost in conjunction with.
I feel like before it was looked at like, oh, she's doing some type of a witchcraft thing.
Yeah. Well, I think it brings more honesty into. I think we can make more and more valid assumptions. I really believe this is going to transcend. This type of thinking is going to push us much further along. If you understand these mechanisms, if you understand these molecular pathways, and then we already have, let's say, studies that have been done on cells with similar pathways, which we're kind of learning that these pathways have validation in many aspects of medicine and in many disease states and cancer and injury and repair. It's like, oh my gosh, wait a second. There's a common language here, and it translates. Like, we could go back through different, insulin and oxytocin and vasopressin, and we can go into these GLP-1s, and we can look at these pathways and say, well, we started with a pathway assumption, and we then looked at the cell culture, and then we looked at the animal study, and oh my gosh, this was all making sense, and then we did the clinical study, and it matched it. Well, holy shit, we've got this map that is actually providing us molecular pathways and mechanisms can almost, I say, predict how a clinical study is potentially going to, the outcome of that is. And that's without AI, that's without all these algorithms. That's like, oh my God, this is the basics of the cell.
And can I give an example of that I always think of? It's back in 2017, 2018, when you were both teaching about and implementing into your patient care the cardiovascular benefits of GLP-1s. And then what, I will not get the year right, but 2023, 2024, when finally these GLP-1s were approved for usage for cardiovascular benefits.
Well, it only made sense because of, again, those mechanisms of improving cell efficiency, improving this process of flexibility of the cell, which is lost in any disease process.
Isn't it just lost with age too?
With loss with age. I mean, it's how it all comes together, and it's a very, again, I'll say this, a humbling place to be, because your mind just explodes, and that's where this is going to be. More people are going to recognize it. There's going to be people far superior in knowledge than I have in thinking and critical thinking, and when if I can spark any of these people to catch this passion for pathways and mechanisms, watch out, because I work hard to get this. There are people that can just do this stuff and probably make me look like a kindergarten guy, right? And this is where it's going. It's gonna be pretty amazing.
Imagine if this type of like cellular medicine could be used in the ICU, though. Like, think of all the patients in the ICU who we could have saved.
Well, and think of the people that we've. Let's take that a step further, and we've consulted with those patients. We've consulted with some of those physicians. We've done that. Mm-hmm. And that's actually pulled some of these critical care physicians into the SSRP, because they're like, oh my God.
They are savable.
They are. And
their kidneys don't have to go. They don't have to end on dialysis.
Yes. I mean, here you go. So
our last grand rounds, over half the room came from the emergency room. It was mostly emergency docs.
Yeah. They're just sick of there not being an answer when there can be an answer.
Well, we've gotten kind of off track with all this, but here's what this paper brings. It brings discussion. It brings some really cool things. So
great work. Great paper.
How did you find the time to do it? I'm not trying to blow smoke or anything, but I mean, we're all constantly bothering you all the time for everything. When did you do this?
Did SEC force you to do this one, or?
SEC is Strategic Executive Controller. That's his assistant. Hi, Robin.
Hi, Mom.
And she can be a bitch on wheels.
That's her job.
That's her job, right? To make shit happen. Gosh, that's a...
I know most of what you're doing. I didn't even know you were doing this.
Oh, there's a
Oh,
lot.
I actually knew he was doing this.
There's a lot you don't know. I don't know. I don't see. I see research and for me, research and clinical practice are the same. It's it's asking questions. It's reviewing. You ask questions with your patients. They make you smarter. You review the biology and the biochemistry and the molecular mechanisms, and you look at the assumptions that are already made and in present day medicine, and then you sit there and go, okay, let's use some common sense and look at this now that I know the mechanisms, I know the assumptions that have been made. Are these right? It's that curiosity and the discipline, that I've had through medicine that make this one. It brings scholarship. Scholarship isn't something extra. It's part of this. So I don't see it any different. And it's just what I do. I don't look at it that way, I guess.
I think he was on a flight, so his options of rabbit holes were limited. So I do think that was the secret.
You're pinning this on him getting it done on an airplane?
Yeah.
I love it. So we've talked about some of the challenges that have precluded a lot of this cellular medicine approach, and we've talked a lot about future directions. What about then current applications? I do think today's performance protocol can really be wrapped up in what the applications are, the applications from the paper. So can you talk a little bit about what some of those results, takeaways were from the actual review?
Well, I think the biggest takeaway is this sets the framework for us to like I said, to ethically look at a structured framework to develop these clinical studies or these evidence-based studies that need to be done to provide the public with the real information and not and that's the messaging I want to bring forward with this is to look at this responsibly now that we have this platform and it's here. It's not going away. And it's in our court. And we really have to respect that. And I'm excited because I don't know how much of this we can discuss here, but I can tell you we're already involved in that, in working. We're privileged to be in a place, the SSRP, where we're already in that realm of getting finally the ability to do a lot of this evidence-based studies to provide the academic world with the answers that people demand and have to be done and has to be. We can never lose that structured, ethical standard that we've built around medicine and the profession. And I think that's what social media and all this stuff destroys. And we have to own it and bring it back.
Is the goal also to bring these clinical studies to the FDA so this can become like a standard line of treatment?
Yeah, we have to have indications that are approved, and absolutely we need to do it right, and we can't cut any corners, and we, as you know, we have some incredible options that are coming up right now, and I think everybody, this is just going to give. It's introducing it into this academic space where there are that's where these people are that demand that professionalism and looking, and then these things are going to be done, and you have to have, you just can't have, you have multiple studies that validate something, right? So this is the beginning of this wave that's coming.
It's a big, exciting wave.
And it's been a long time. It's been the timing, when Omar reached out and you looked at me, because this happens. We get asked a lot to help on papers and do, give our impressions, and when it was, most of them don't go anywhere. And Madison just one day looks over the computer and asks me this question, and I'm like, I think you were surprised. I go, I said, Madison, I think it's time. I think this is it. Let's follow up on this, and Omar, who is part of the following the SSRP and believes in the science, is a incredible individual that was driven to do something right and responsible. And it's a beautiful thing to see in the younger physician group, and I give him so much credit for questioning and curiosity, but doing it right.
I do think you inspired him as well when he found out you were an orthopedic surgeon, because he had no idea when he first heard that you were an orthopedic surgeon. He was like, no way he's an orthopedic surgeon. Like, his brain works in just a completely different way. So,
did he read my book?
He did read your book.
Oh, okay. Well, Maddie, thank you for bringing this up, and thank you for pushing this paper forward where people may have more curiosity and want to understand more about what we're trying to do right. And let's see where this all goes. And I'm excited that you're with us today. And I don't have words to say.
He's so lost in the moment. I'll do the outro.
Thanks.
Thank you for joining us on the Redox Revolution.
Yeah.
I'm Matt. That's Maddie.
And I'm
Doc.
Doc.
We'll see you next week.